So this story is both frustrating, but at the same time a wake-up call. So as you may have heard, the US government, along with the governments of a series of European countries, have issued a series of executive orders and policy changes, essentially cutting significantly their portions of foreign aid and instead choosing to focus on their own security and defense priorities and their own economies, essentially. But guess which continent is left extremely devastated by these decisions? That's right, it's the continent of Africa. With many reports coming in that the healthcare system across the African continent is struggling. Many hospitals, health posts, and healthcare institutions are reporting the failure or the lack of funds to procure services such as oxygen services, lab and diagnostic equipment, data systems. Some health providers are reporting an inability to provide antiretroviral drugs, HIV life-saving medication for people living with HIV. And this is not because Africa doesn't know what to do. It's simply because we didn't invest in our own healthcare systems. We didn't invest in our own resilience. We didn't invest in our own sovereignty and independence when it came to the healthcare sector. And now we're suffering the consequences. Let's be clear. Africa's development plan for health cannot be rooted and based on the foundation of foreign generosity. Heavy dependency on the generosity of strangers is not a strategy. It's not a sound policy. It's a ticking time bomb. And particularly for health, this is a disaster. Why is it that after 50 years of independence, on average, African countries, sovereign states, are depending on donors to pay for their hospitals, to pay their health workers, and to pay for essential life-saving medication such as antiretroviral drugs? This is not only unsustainable, it's reckless governance. Education, security, and health are essential aspects of any civilization, and these cannot be outsourced. And yet African countries outsource these three essential elements of their own survival. And now the world has changed and suddenly Africa is paying the price. If we want to live in a world where Africa is independent and stands on its own 2 feet, Africa cannot continue to rely on donors, on foreign entities for critical aspects that are linked and are crucial to its own survival. So either as Africans we build it for ourselves or we collapse when they stop caring.